Your cat has this very difficult to treat and painful condition called stomatitis. These are my top 7 remedies to treat it, and you need to stick around to the end because it's a brand new and surprisingly effective one you should really know about.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
A cat with stomatitis, they'd have gums looking almost like this. What you're seeing is this marked gum inflammation. It is very painful. In practice, I barely touch the gums of the mouths of these cats and they'd start to bleed. Think about it like the worst gingivitis you could possibly ever imagine, and it's even worse than that. The underlying cause, it's been postulated that it's to do with the bacteria, the plaque growing on the mouth. There's some type of immune reaction. The immune system responds inappropriately, attacking the mouth, seeing all that marked inflammation. We know that when some of the gum tissue is biopsied, we'll see an increased number of a certain type of cell called a eosinophil. And this is the type of cell that infiltrates the skin during an acute allergic reaction. So if your cat has all this marked gum inflammation, you've seen your veterinarian, they diagnose feline stomatitis. These are some specific remedies you should be considering before you go with the most drastic option. Many veterinarians, my one included, would look at these cats, see all this marked gum inflammation, diagnose feline stomatitis, and tell the pet parents, sorry, but we're gonna have to extract all of your cat's teeth. Remove all the teeth from the mouth of your cat. The thought is, if these teeth aren't here, there's no plaque to accumulate, there's no immune response to the plaque, it should solve the stomatitis, right? But there's a couple problems with that. First, it's very invasive. Just imagine having all your teeth extracted, very painful for our cats, in spite of general anesthesia. Some cases, they're part of roots are left behind. Sometimes it's really hard to properly remove all the teeth from a cat. Then lastly, about 20-25% of cats that have all their teeth extracted still have signs of stomatitis. So it's really important, first and foremost, you try some less serious interventions first. You then may be able to treat your cat's stomatitis at home without having all their teeth extracted. Number 1, consider a natural antibacterial. Propolis in the form of a capsule, in the form of a spray, that is a great option. It's also known as bee glue. It's a product of honeybees and is probably the most effective natural antibacterial, especially for dental disease. Antibacterial, anti-inflammatory, can specifically target all that gum inflammation. A propolis capsule dose, about 100 milligrams per 10 pounds of body weight daily. You can also use propolis as a spray. I've even used it on myself for a sore throat. Just spraying it on the upper and lower part of your cat's gums, you're doing that twice a day. Regardless, you can start with this, treat for a minimum of 2 weeks, you start to see improvement, and if you are, continue for another 2 weeks. Number 2, you need to manage the pain. The best holistic painkiller for our cats, it is this CBD cannabidiol. Stomatitis is very, very painful. Your cat needs to have adequate pain control. And on non-steroidal anti-inflammatory drugs, they are not safe to give to any cat long term. CBD is a much better option. We'd be looking at cat doses of 3 milligrams per 10 pounds of body weight twice daily. That equates to 1 drop per 10 pounds of body weight twice a day of our CBD supplement. Number 3, this is a topical OTC 1% hydrocortisone or an oral natural product. This is Dr. Jones's licorice root extract. For many of the cats long term that I saw in practice, we had to get them on a corticosteroid just to markedly suppress the immune response, decrease all that local inflammation. So one over-the-counter option, pick yourself up some 1% hydrocortisone, and what you can do is put a small amount, a 1/4 inch on the end of your finger, rub it on the inside of your cat's ear. You're going to be doing that twice a day. They're going to absorb some of that corticosteroid. It's going to help decrease some of that inflammation. But the steroids themselves, they can have some potential big side effects long term. Increased drinking, increased urination, increased chance of our cats having an immunosuppressor response, increased chance of your cat being a diabetic. Meaning you don't want them on any type of steroid long term. So a good oral natural alternative, licorice root extract. It's considered the natural corticosteroid. It can markedly decrease inflammation. You're dosing your cat at about 1/4 ml of the tincture per 10 pounds of body weight twice a day. Our licorice root is a great option in that it is non-alcohol based. It's a glycerin base. So you'd be giving about 1/4 of a tincture, which is that amount there. You'll be giving that twice a day. And with the licorice root, it's also not meant for long-term use. You want to be using that for a maximum of 14 consecutive days, then 7 days off. Number 4, the probiotics. This is Dr. Jones's ultimate probiotic formula for cats. There's all this gum inflammation. We know it's from an abnormal immune response. Think about what's happening in an allergy. That's where we're seeing all these eosinophils. And we know in many cases the probiotics, they can help normalize that immune response. A good multi-strain probiotic formula may help. Ours is a good option. It's got 8 different specific probiotics, ones that are specific for cats, and ones in high CFUs. We have 5 billion CFUs for capsule. But in giving it to your cat, what you do is you be opening up the capsules like this. You're going to sprinkle it over top of your cat's food. Then we know as they eat, they're going to ingest and they're going to start to accumulate this good bacteria within their mouth. If you've got a cat with stomatitis, you've never tried probiotics, I encourage you to do so, but you need to give it for at least a minimum of 30 days before you can assess whether it's being beneficial or not. Number 5, this is the amino acid l-lysine. Lysine is primarily used in our cats because it's such a great natural treatment to help treat underlying viruses, specifically the feline herpes virus or the virus that causes the cat flu. I saw many cats in practice respond really well to l-lysine. But many cat parents that have cats with stomatitis, they've seen their animals respond to l-lysine. And in some cases, some of the cats, they can be maintained on just a few treatments, but l-lysine has been one of the core ones. In all likelihood, these cats have an underlying feline herpes virus infection, and what the l-lysine is doing is suppressing that virus. So then their immune system can react more normally, not attack the gum tissue. Standard l-lysine doses, about 100 milligrams per 10 pounds of body weight daily. And if you've got a cat that has stomatitis, if you've never tried lysine, I encourage you to do so. Number 6. This is a type of seaweed specifically for dental disease in our pets, Ascophyllum nosodum, also known as Plaque. Plaque has been around for years. It's been used in hundreds of thousands of pets. Some respond well, some don't. But many cats that have stomatitis, they seem to respond well to Plaque. The way it's working is the seaweed itself, it's really high in iodine. Because of that, it's got some really good antibacterial properties. So what you're doing is you're just sprinkling a small amount of this Plaque. Maybe I can get it out, maybe I can't. There, look at it. Teeny tiny little scoop. You scoop a teeny, there it is. This little teeny scoop goes onto your cat's food, 1 scoop a day. The average cat, they're gonna get about a half a scoop, half this little teeny scooper full per day. Number 7, the over-the-counter antihistamine Cetirizine, sold under the brand name Reactin in Canada, Zyrtec in the US. Zyrtec, it has been well used in our cats for an array of different conditions, specifically the skin diseases. It can help cats deal with skin conditions such as eosinophilic granuloma complex. They might get these red lesions, perhaps underneath their chin. It can help our cats with feline acne. It can help our cats that get these type of ulcers called rodent ulcers. Also help our cats that get this, feline stomatitis. In all those cases, the underlying cause is an increased number of eosinophils, meaning we have an abnormal allergic response. And feline stomatitis has just been so difficult to treat for so many cats. It's great to see that a fairly inexpensive over-the-counter medication can help. There are a number of different veterinarians. The one OTC med they swear by for cats that have stomatitis, it's Cetirizine. The other nice thing about Cetirizine, it just has to be given once a day, so you have once daily dosing. And it's now off patent, so you don't need to get the brand name of Reactin or Zyrtec. You can get a non-brand name Cetirizine, much less expensive. Standard cat dose, 0.5 milligrams per pound. So a standard 10-pound cat will be getting 5 milligrams or half of this tablet once every 24 hours. The tablets, as you can see, they're not tiny, but when you have one, at least it's potentially manageable to get it into your cat, and or crushing it, putting it into your cat's food. If you have a cat with stomatitis, nothing else has worked. You don't want to go to the extent of having all your cat's teeth removed. At the very least, go and get yourself some Zyrtec, get the Cetirizine, try it. Thanks so much for watching this edition of Veterinary Secrets of what to do for stomatitis in our cats. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.